All right, so next up, I'm going to be talking about the Rocky Mountain Spotted Fever. So just to look at initially, the Rocky Mountain Spotted Fever affects our cardiovascular and tegumentary system. So the Rocky Mountain Spotted Fever is most known as a category disease that fits into the spotted fever rickettsiosis. So it's an SRF disease. That's how it's mostly categorized, and it is caused by the bacterium Rickettsia rickettsii. In the most recent years, it's become clear that there's a variety of the Rickettsia species that cause a similar disease, but they're mainly caused by a few different kind of ticks. So a dog tick, the Lone Star tick, and the wood tick are the three primary ticks that cause the disease. Um, it actually was first detected in the United States, so that's why it was named the Rocky Mountain Spotted Fever. But the cases are actually most concentrated within the southeast and eastern seaboard regions. We also can see it a little bit in Canada and Central and South America. So yeah, looking at the transmission, we see the majority of the cases occurring in the spring and summer when the tick vector are the most active. And we often see that the spotted vector induces an apoptosis in cells lining the blood vessels. So this is typically how we see it affecting our body. And then initially, kind of within 2 to 4 days, you can end up seeing fever, chills, headaches, muscular pain, kind of fever-like and flu-like symptoms. And it can lead to like lesions and gangrene, which are the most worse symptoms you can end up getting from that. But the cardiovascular things you can see are hypertension, and then thrombosis and hemorrhages would not be ideal either. But diagnoses are kind of tricky because before you can actually diagnose this, you would have to kind of be suspected of having it. So to treat it, you kind of have to know you have it. So you'd have to be in a region where it would kind of be rapid, and then you could be treated for this, and then hopefully the diagnosis would come back as positive. But it's kind of a little bit tricky. But suspected cases are spotted. Um, a spotted fever require immediate treatment for lab confirmation, and then specimens are taken from the lesions on the body and used for PCR assay. So yeah, after a case is diagnosed, patients are treated with doxycycline for typically about 1 week. That would be a good case. And then hopefully after that week, you would start to experience just mild symptoms, or hopefully it would go away altogether. Yeah, and then as I talked about, majority of the cases are concentrated in the southeast and eastern seaboard nations, and we do see a little bit in the Rocky Mountain regions here. So this is kind of the U.S., but it gets a little more east, as you can see, towards the coast and up in the Maryland region too a little bit. But yeah, that's all about it for Rocky Mountain Spotted Fever. Hope you guys enjoyed.